Hello, everyone. My name is Chloe Edwards with Voices for Virginia's Children. I'm our Advocacy and Engagement Manager, and today I'll be walking you through our 2021 General Assembly session priorities as it relates to access to healthcare. A little bit about Voices. If you're not familiar with us, we are Virginia's only multi-issue child advocacy organization specializing in health, mental health, family economic security, child welfare, including foster care and adoption, early childhood education, trauma-informed care, and equity. We're also home to Virginia's Kids Count Data Center. We're nonprofit, which means we are also nonpartisan. We work with everyone, Republicans, Democrats, independents. We're also privately funded, and that's to maintain our independence and ensure there are no conflicts of interest when it comes to our advocacy. Let's think about the impact of COVID-19 on health. Well, there's the obvious connection. We know that COVID-19 is one of the leading health um, causes of deaths right now. We also know that COVID-19 disproportionately impacts communities of color, in particular Latinx and Black communities. But what we've ultimately been witnessing is how COVID-19 affects the social, economic, cultural, environmental conditions when it comes to the social determinants of health. When it comes to thinking of how one's education can impact their health, their work environment, their living and working conditions. Is there a toxic waste center built near their home? Are they employed and able to meet their basic needs? Do they have access to healthy foods? Water and sanitation plays a huge role. Do they have access to healthcare services, housing? All of this in combination impacts the social determinants of health. We also know that trauma-informed care, which is multidisciplinary, just like the social determinants of health, equity, which is multidisciplinary, it influences the social determinants of health when it comes to resources and the distribution of those resources. We know that when someone experiences adverse childhood experiences, this also contributes to negative social and health outcomes. All of these play a role. It's layered and layered and layered when it comes to the social determinants of health. And so what we've been witnessing with COVID-19 is those health disparities, right? And that's why we're also supportive of Delegate Aird's resolution to declare racism as a public health issue, because racism, inequities, discrimination, prejudice, racial trauma is also a trauma. All of that in combination inadvertently impacts the social determinants of health. And that's why it's been alarming for individuals who may not have been familiar with this to witness the disproportionate impact on communities of color that COVID-19 has. So I just wanted to paint that picture for you before I walk you through this policy agenda. And then you may be interested, if you're really interested in the concept of the social determinants of health, and viewing our campaign for a trauma-informed Virginia racial truth and reconciliation policy agenda video too. So what does this look like when we're applying an equity lens? And so again, this weaves into the social determinants of health that I was talking about. Does someone have access to food? Are they able to meet their basic needs when it comes to paying the rent? Do they have health insurance? That plays a huge role, especially when we're in a health pandemic. And then mental health also plays a role when it comes to the social determinants of health as well. So when applying an equity lens, we know that when parents have access to health insurance, children are more likely to have insurance. And this inadvertently increases their access to overall health and well-being. However, there is still a percentage of the population that does not have access to health insurance. According to the Census Household Pulse Survey, 11% of adults with children do not have access to any health insurance in Virginia, compared to the national average of 12%. In addition, what we're seeing is significant racial and ethnic disparities in healthcare access. Nationally, at 23% of those identified as Latinx, 14% African Americans, and 20% of adults of two or more races reported that they lacked access to health insurance, and compared to 8% of white people and 7% of Asians. Now, without insurance, families are forced to decide to not get the care they need. More than a third of people with children reported that they had delays in getting medical care in the previous month. And so you can zoom in on that chart. Hopefully you all can see it. as it relates to the data, especially when we disaggregate data by race and ethnicity, we can shed light on some of those disparities. And so this leads to identifying the solutions and policy interventions to increase access to health care. So one is extending Medicaid coverage for legally residing young adults from 18 to 21. Now, last year we advocated for famous moms, and we also advocated for 40 quarters, which increased access to health insurance for the immigrant population. It's contingent upon federal approval to whether we can reduce the 40 quarters rule. But extending Medicaid coverage for legally residing young adults to 18 to 21 is something that we are supportive of this year. The Virginia Department of Medicaid Assistance requested this change for the 2021 budget. Extending Medicaid coverage for legally residing adults aged 18 to 21 would help decrease disparities in healthcare coverage by ensuring young people starting off in life and in their careers have access to healthcare coverage. So we want to inadvertently reduce the overall disparity by expanding access to this particular population. As it relates to famous moms that I had mentioned, famous moms allows low-income mothers to gain access to health insurance. Last year, like I said, we advocated around 40 quarters. But what we're advocating for this year is even more expansion. In order to liaise important early and regular prenatal care to increase the likelihood for healthy birth outcomes, we are advocating that famous moms is extended to not just all pregnant women, but also including undocumented immigrant mothers. So it further alleviates a gap in access to health insurance for that population again this year. Third, we're asking for expanded Medicaid coverage for emergency services for COVID-19, including screening and testing to all immigrants, meeting financial eligibility criteria as previously extended in 12 other states. Like I mentioned, several other states have taken these steps, so we believe Virginia is poised to do the same. Federal law allows states to cover COVID-19 screenings, testing, and all related treatment for immigrants who meet financial requirements for Medicaid, but do not meet the immigration status requirement. This policy change would assist lower income immigrants in obtaining needed health insurance, and we believe that's important, especially when it comes to the spread of the coronavirus. By extending the coverage to this particular population, it would benefit all Virginians ultimately. And then I added this another item, which is also the campaign Racial Truth and Reconciliation policy agenda, but it's connecting parents to supports that foster resiliency and positive health outcomes. And that's through Virginia's home visiting program, which is for low income parents. And again, it gives them access to resources and supports in order to assist them as parents, as first teachers. And then it also is proven to contribute to positive health outcomes. The other thing that we're advocating for is Medicaid doula services through Medicaid, and the home visiting program would also be funded through Medicaid as well. But there is maternal infant health mortality disparities as it relates to, in particular, Black women dying during childbirth at disproportionate rates in Black infants. So by having Medicaid reimbursement for home visiting as well as Medicaid coverage for doula services, we will again shorten that disparity once again. Now, we do have a untraditional General Assembly session this year. And so we're going to have a digital advocacy day for the campaign for Trauma-Informed Virginia, Racial Truth and Reconciliation. This will give you the opportunity to advocate around a number of issues across sectors, so not just health. And we'll also have an advocacy training to prepare you. And we have other events planned. So make sure you visit vakids.org and click events in order to get an idea of all that we have planned and all the opportunities we have to engage you in advocating and raising your voice this General Assembly session. Now, if you have any questions, do not hesitate to contact me, Chloe at vakids.org. You can follow at VAKids on all social media, and you can also follow at Racial Truth on all social media. I just wanted to shed light that the Perspectives that contributed to this policy agenda was the Healthcare for All Virginians Coalition. We're supporting their policy agenda items this year. And then the Racial Truth and Reconciliation Coalition, as well as the Trauma Informed Community Networks, contributed to the perspectives that helped us build this policy agenda. Thank you for tuning in with us, and we hope to see you during the General Assembly session.